The government of Jamaica has been trying assiduously to ramp up engagement with citizens through health-oriented initiatives.
These initiatives have yielded a myriad of run walks, health fairs, and medical camps.
And you know the popular saying, your health is your wealth?
And it stood the test of time for a reason. And today in Port Maria at the free medical camp hosted by Heart Trust in collaboration with the Indian High Commission, we'll show you the truth in these words. I'm Raquel Robinson.
And I'm Melvin Pennant. So join us as we bring you coverage of this event. This is PBCJ's Agenda Jamaica.
Pleasant viewing.
The idea with Jermaine, with Dr. Ashish here and Ms. Williams here, who have very thankfully offered to use this location, this particular very institute of NTSA for organizing this medical camp, and that's why we are here. What I've learned from Ms. Williams is that her students here, she felt that she needs to do something about them. About their health, educate them, sensitize them, and also do a kind of a health sensitization. So she came up with this idea with Dr. Ashish, and then Dr. Ashish being our one of the most active doctors in this region in organizing medical camps. This idea took Jermaine, and now we are today, thankfully, to this. That's why.
Heart NSTA Trust is all about human capital development, and human beings are well-rounded beings. So they come to us for TVET, for training, and I believe that holistically they must be supported. And so I thought about having a health fair to promote physical wellness rather, as well as mental wellness. So if you'll recognize that the persons who we have invited here not only focus on the physical health but also the mental health. I have been supported very well by Dr. Babu and his foundation, as well as the Indian High Commission. We have Choose Life International, who is also here providing mental health support. The trainees in the parish, sometimes we have to be all in one and a holistic kind of environment for them. Staff members as well, we take for granted sometimes that the staff members have time to even take care of their physical and mental health wellness. So we have seen it fit to take all the support that is required and to bring it here on campus so that both trainees and staff can benefit. It's a first for me here. It's an inaugural health fair, and I think it's something that we would want to have annually if possible, because one thing we have done is to reach out to the community members for them to actually know that we're here, because we take for granted that some community members actually know that Heart NSTA exists in this space. And so when we would have been publicizing the event, a lot of persons were saying, hey, can I get direction to come to Port Maria VTC? So it has given us many benefits for the students and for the staff, but also for the members of the community. I want to take the opportunity though to also thank some of our other sponsors. Big up Dr. Babu and the team from Ashish. We actually have a partnership with Ashwin Nursing School, where we are training allied health workers in geriatric and patient care. And that partnership has seen the fruition of this actual health fair. We want to also thank Food for the Poor, who have made donation of food items that we can now be distributing to our trainees and members of the community. We have had PATH come on board, NIS have come on board, the banks have come on board. We even had Hyundai showcasing some of their newer model vehicles here this morning. And the Ministry of Health The Northeast Regional Health Authority, I must say big up to Dr. Tamara Henry. She has really and truly supported this health fair by providing a lot of the services. A doctor to actually take time out to come, and you know how the health system is. We want to thank them for that as well. So we really have a variety of services here, and we're grateful to have this opportunity for trainees and for the members of the community to know that Heart Trust is not just about TVET, but we are about the holistic development of the human.
I'm so happy to be a part of this today, and where we have a chance to serve back to the community, where we seen that because especially this time, especially this is a flu season, because we have seen even in our private practices or health centers, a lot of patients, especially the children and the adult, they have coming with a lot of flu symptoms. Then we thought that okay, it's the right time that we can come out of our personal life and just come and do some social service as we do every year with the collaboration with Indian High Commission. They conduct so many camps. Then this time just we seeing today, even this morning we have seen couple cases very interesting to us, because some people they don't even know that they are diabetic. So because the screening is very important for everyone life, because until they don't screen, they don't know that what is going on with the families.
Please come and try our free services here. The service is excellent.
What do you think? Hi, Doc. Good afternoon. I was recommended to come and try a free service, so go ahead. I hope there is no needle involved, because I'm afraid of needles. In Jamaica, like most men, I have fear of going to the dentist, the doctor, but it's for your own personal health. Visit your dentist, visit your doctor. It is utmost important that we do our regular checkups, get those teeth clean, get your dental hygiene intact, because it is very beneficial to proper health.
Based on the care that you've administered today, do you see people taking their dental hygiene as serious as other health concerns?
As far as I see the cases today, so people are waiting for the teeth until they gives it the pain. So until the teeth gives pains in it, so the people are going simply taking out of the teeth and going for the dentures. So the teeth are very, very important, because the teeth are once in a lifetime. So the teeth are not only important for the purpose of the aesthetics, the teeth are very important for the chewing of the food materials. If we take the proper care of the teeth, so like the preventive treatment, so that is going to the dentist for the every 6 months, so routine cleaning of the teeth, and for the doing the sealants, and for the children, so applying of the topical, the APF gel. So these the preventive treatments are very important for the teeth not to lose.
So we caught another patron, and we're going to ask him what's his favorite part about the health fair today.
The dental checkup was okay, and also I checked my pressure and it was okay. So it was a lovely day, and I enjoyed it. Yeah.
And do you think this benefits the community?
Definitely, I think so a lot. It helping out the people and with them health and knowing what's going on with them and everything. It's fine, yeah.
The place is extremely busy. The doctors are busy, so I'm going to try and sneak a quick clicker chat with this doctor here. Good afternoon, doc. I know you're busy. I'm not going to keep too much of your time. But how has it been going so far?
Oh, it has been going exceptionally well. It has been good so far. The turnout has been great. I've seen patients with a host of conditions, from those who are hypertensive to those who are diabetic, those who might have just a bit of musculoskeletal pain, some with heart conditions. So they are interested in their health, so I'm here to help them along on their healthy journey.
So we're in this cool parish of St. Mary, where there are lots of beaches. And if you get a time off from work, why did you volunteer to come here today when you could have gone on the beach or something?
Okay, because I believe that helping to heal others is the highest form of service, and it helps to restore not just bodies but also humanity and the soul in an essence. So I'm big on service above self.
This is the first for medical camp for you, or you've been doing this for quite some time?
Well, not really quite some time, but as of late. So this has been the second thus far. So I'm looking forward to doing many more.
Thank you, Doc. So you see, people truly dedicated to service to get Jamaicans healthy. Thank you, Doc. Ministry of Labour and Social Security. This is a health fair. What's the reason for you being here?
Well, the invitation was extended and we answered, and we are here giving information to the public. So under the Ministry of Labour and Social Security, we have different departments, but the departments here today are NIS, National Insurance Scheme, and the Public Assistance Department, mainly the PATH section. Now on the PATH section, it deals with persons who are what we would call indigent, where persons may need assistance with children to go to school, dietary need, all of that. We offer the PATH program where they get a bi-monthly payment, so persons can come on down to the office to do the application for their family.
Hold on, let me get that straight. You're saying the Ministry of Labour and Social Security does offer assistance in the medical field?
It offers different grants. So yes, we have a compassionate grant that goes towards persons who may have medical challenges. So let's say a person has a test that needs to be done, but they're not able to afford to do so. You can come into the office and we can help you to access a grant to pay for this. We also assist persons with the repairing of their homes. Persons who may have a family member who is deceased and they're not able to bury them, we offer a grant towards the burial. We also have grants towards school fees. We have grants towards buying books for our computers for persons who are at the tertiary level. We have grants where we help persons to start a small business or to boost their small business. We have grants to, did I say school fee? So we have school fee, and we also have short-term employment. So there's a lot that the Ministry of Labour and Social Security, more specifically the Public Assistance Department, offer. So persons can just come in the office, seek the information, and we'll tell you what grant, what program will best suit the situation that you are in.
Okay, thank you. I didn't even know the Ministry of Labour and Social Security offers so much services to the public. It's amazing. Information is king.
Medicine is a large part of medical care, and when medicine can be so expensive and when you need so much, it's difficult to have the proper care that you need. But today at the Free Medical Camp in Port Maria, we're getting a taste of what freedom and freeness can do for patrons. And we want to know, how can they give away so much? So that's a question to you.
Okay, hi, good afternoon. So this is possible because of our Indian pharmaceutical companies and our Indian High Commission. So we have an organization by Ashish Healthcare Community Organization. So we realize, and we are doing this for more than 10 years, because the community in St. Mary, we usually serve them the most. But in everywhere now in Jamaica, we do every month medical camps. So the giveaway stuff and the free medical stuff is necessary for the people here because it's so expensive to import from other different countries to Jamaica. So we usually link up with our Indian pharmaceutical companies like Indus and BioPris, which they give us some of the very good medications, which are the same brands. So that's how we think it's helpful for Jamaica who are in need.
Greetings to everybody in Port Maria. As you already are aware that High Commission of India has been actively organizing free medical camps along with its partners, the Indian doctors, Indian community doctors, as well as Indian community associations regularly. This is our 40th medical camp in the last years, so many years. We started the first medical camp during COVID. We have been organizing medical camps with the help of our stakeholders around Jamaica, in all regions, in all parishes, in all areas which are where we find that there are need to make an outreach to the community. You are also aware with our motto of reaching the unreached, serving the unserved, and touching the untouched, which has been the guiding in our organizing of medical camps. Port Maria especially is a very key and important area for our medical camps this time, because we have not organized a medical camp in this region before. But this time we have, with the help and support and association of Ashish Medical Care, Ashish Health Foundation, which is based here in this region, we have decided to organize this particular medical camp in association with the Heart NTSA here.
This has been PBCJ's coverage of the Heart Trust Vocational Training Center's medical camp. I'm Raka Robinson.
And I'm Melvin Pennant. Thank you for watching.
This has been Agenda Jamaica.